So today's webinar is, I've given it the title Finding Your Voice, and it's about partnering your healthcare team with confidence. And in the blurb that we put up on the website, it was very much the if you're anything like me, it's I invariably come away from a doctor's appointment or various different situations thinking, if only I'd said that, why didn't I say that, or why did I miss that out? And I'm just assuming that's for some of you, the reason why you've decided to come along is because that resonated with you. And so today, what we're going to be doing is really trying to unpick how we can kind of approach any conversations with our healthcare teams with confidence and in a way that we where we hope to get what we need, right? And that's not criticizing our health professionals who are looking after us and looking out for us, but really in how can we be confident enough to really put across what we want. And if it's not actually in the actual session with that person, how can we reflect and go back in and look for what we want? Okay, so first things first, what I'll always do is remind people, and you'll get very used to this as we go through the webinar, is that invariably when we're in a healthcare consultation or an appointment or going through an investigation, our minds can be all over the place. And it's important that we actually learn how to just pause, even if it's momentarily, just to let everything settle so that we can actually be in the best place possible to be listening and to be asking questions. And so often in all of the webinars, I'll put up this one, is this idea that Albert Einstein, you can always look to him for a good quote. He will say, and sometimes I think 99 times I find nothing. And sometimes if I stop thinking, swim in silence, the truth comes to me. So it may sound a bit kind of poetic, but basically what he's saying is that if we can pause, let the busyness of our minds settle, then often we can be more equipped to actually say what we want or ask for what we want. Okay, and hopefully that will make more sense as we go forwards. So what we're going to cover today is why confidence matters, what makes us hesitant in some of the conversations that we have, but also some strategies for having more confidence in our communication, but also how to build a partnership with our healthcare teams. The other thing that we'll do a Q&A at the end where I'll switch the recording off and you can ask whatever you wish, but also we'll pick up on any of the questions that are coming up in the chat. But the other thing is that many of the ways that we can help ourselves are actually already available within the Better Together kind of program of support. So those are being able to use your community to kind of share and to get advice. But also the emotional well-being team, we do a lot around stress management, a lot about managing anxiety in particular situations. We do mindfulness, we do all sorts of other webinars. So although you're speaking to me or you're hearing from me as a webinar facilitator now, you are so welcome to actually put a referral or ask for an opportunity to speak to myself or my colleague Amy or one of the other kind of outreach supporters such as Zoe about these sorts of situations so that you're not on your own at all. Okay, so but what we're going to cover hopefully are these particular things. So starting off really with why confidence matters, and I'll just make sure that I've got my notes in front of me. All right, so I'm not dealing with a chronic condition myself or within somebody I love, and yet I know what it feels like to go into just my GP and be worried about how they're perceiving me, that I'm perceived as difficult, that I'm asking awkward questions, or there are people who are way more deserved of their time than I am. And that all gets in the way of me actually asking for what I want and feeling confident in terms of communicating the symptoms that I'm experiencing and what I need. And so that's happening for me, who's not dealing with some of the situations that you're in. And so therefore it's even more important that I can do, or we can do, whatever we can to help people feel more confident in their appointments. because studies say that it basically that if people are more engaged with their health team, then they get a better outcome in whatever shape or form with the condition that they're experiencing. And one of the things which is really important is the way that not only you and I and our communities appreciate that, but also other organizations, like, for example, the Patients Association. And what I'm going to do is I'm going to show you a short clip, which hopefully you'll be able to hear. So Zoe, can you give me the thumbs up if you can hear it? Yeah, and if you can't, then I might have to just give you the link and talk to you about it. But I quite like you to hear it because it talks about the 6 key principles that they've put together around patient partnership. So it's the idea that in actual fact, our health professional colleagues are mindful of they need to help us be as comfortable as possible and as confident as possible in any sort of appointment. So let me just show this to you and see what you've got to say about it. So I'll just try and get it to start.
The 6 principles of patient partnership. Partnering with patients in both their own care and treatment and in the design and delivery of services has multiple benefits. These apply to patients at an individual level, the services they use, and to the NHS. These benefits cover 3 key areas: quality and outcomes, cost effectiveness, and safety. In a well-resourced system, patient involvement enhances services and drives them towards excellence. In an under-resourced system, it enables scarce resources to be used to maximum effect. Failing to involve patients in either of these scenarios has 2 inevitable consequences: poorer outcomes for patients and ineffective use of public resources. We have identified the 6 key principles of patient partnership. We worked with patients to develop these principles, as well as national and local health organisations and health and care leaders. The principles we've identified are treating patients as equals, patients who are fully informed, shared decision-making and patient partnership, recognising inequalities, seeking patient input, and joining services around patients. In the last decade or so, we have seen huge strides in the recognition of the importance of patient partnership in numerous forms of guidance and strategies that have been issued to help shape the health and care system. We recognise that understanding how to implement these principles can be daunting in practice, particularly for newly formed organisations taking on new responsibilities, building new relationships which may be in the early stages of the journey towards working more closely with patients. At the same time, patient partnership should be embedded in the NHS structure. Here at the Patients Association, we aim to help organisations in putting these principles in place. With this in mind, we have developed a number of measures that organisations can put in place now, as well as how they can be achieved and their success measured. For more information on these measures and other resources, please contact Sarah Tilstead, Head of Patient Partnership, via the details shown on screen. The 6 principles of patient.
Okay, so the reason why I was showing you that video is to emphasize that those people who are providing the services, so the healthcare professionals themselves, want to help patients to be much more involved in being treated as equals, in being fully informed, and in sharing decision making and patient partnership. They want to recognise the inequality in terms of healthcare, and they also want to seek patient input, and they want to join the service around the patient. Right. So these are 6 principles which sound incredible, and as anybody, we would welcome that this is the intention of the NHS, but it doesn't always feel that way, right? And also, it does require us to actually bear these in mind to help us feel more confident in terms of what we're asking for. Okay, so what I've done here is I've given you a link to the Patients Association, which is always a really useful resource in terms of helping people to feel more confident. There's lots of things in there in terms of patients' rights, in terms of how to ask for second opinions, for what you can expect. So I'm putting that in the background so that you know that people are actually wanting you to be much more involved and feel more confident in being partners in your healthcare. But things get in the way, right? So what I wanted to talk about now was really it's what makes us hesitant, right? What is it that makes us hesitant? Why don't we ask for help? Why don't we ask the questions that we're wanting to? Why don't we ask for a second opinion? Why do we come away from a consultation perhaps feeling that we're not understood, or they're not understanding me as a mum about my daughter, or they're not understanding my daughter, or they're not giving us space to actually ask the questions that we want, or they're not taking into consideration what's important to us? Okay, so what I wanted to do was actually ask you to do a quick Mentimeter exercise, right? So if you could bring up your phones, and if you can open the camera, and then, or whichever way your phone works, pull up the Mentimeter website, right? So the QR code should take you to 3 opportunities to say why you don't speak up. Now, your whatever you put in there is anonymous, right? What we're going to do is build a word cloud of some of the common reasons why we don't speak up, why we don't ask questions, or why we don't speak up about our care, right? And I just wondered if you would feel comfortable just popping whatever you're able to in there, and then I'll show you the word cloud after we've finished, after it's been built. Okay, so I'll give you, we'll just take a minute or so here. I'm just noticing there's a chat. Oh, right, yes, of course. What I'll do is I'll find the link. It won't be a second. Or Minnie, I might be able to, second. I am sorry, Minnie. I'm finding that I'm trying to get out of something so everybody's got the QR code. I'll stop sharing at the moment, and that'll help me to actually get what I need for you. Wait me a second. Hopefully, Minnie, that's come to you now. Okay.
That's perfect. Thank you.
And what I'll do is I'll just check what's happening on the Mentimeter, see what's happened with the cloud, right? And you'll be able to put, what I'm going to do is I'm going to present it now, again, with just in the interest of time, but there'll be space for you to actually add more in, and we might actually leave it open and share it more generally, so that we can actually build up some of just what's going through our minds, right? So, right. So what I'm going to do now is I'm just going to share it, and then we can have a chat about what sense to make of it, right? So can everybody see it now? So can you see the word cloud that we've just generated? So that's just 8 of us actually putting things in. So already we've got the lack of confidence, the worry, yeah, sometimes things can be so quick that it's quite hard to process what's coming at us, particularly if somebody's speaking in a language that isn't ours, right? And that isn't necessarily just that they're speaking English and your first language isn't English. It can be that the healthcare team may be best intended, but they're using terminology that just doesn't actually make sense. There's also the busyness of the NHS. It's like we're all decent folk, and if we can see people are really busy, we hesitate to actually add to that busyness. Fear of silly questions, cultural reasons. Our values, our cultural expectations might be different to the person in front of us who's trying to help us. You've been ignored in the past when you've asked us, or you don't know the right question to ask, or you feel ignored or belittled, right? These are they're tough ones. And if you've had that sort of experience, then why would you feel confident going into the setting again, right? There's also that sometimes you can be receiving information that you weren't expecting and that you're not prepared for that situation, right? Or simply you feel very anxious, and you're anxious and you forget, or you forget. Your mind is very busy with all sorts of things that are going on in your life. So so you should be, so what we'll do is we'll make sure that in the recording, you'll be able to look at this recording afterwards and see the word cloud. But we'll have to, again, move on now. But I'm just wondering, does anybody want to comment on it before we do move on? Is there anything surprising there, or is it like much as you thought it was going to be? Yeah. So Sheila.
Yeah, no, can you hear me?
Yes, Sheila, yeah.
So when I was talking about cultural reasons, so I live in beautiful Italy.
Yes.
But in our country, and I think it's the same in many others in Europe, if the doctor says something, don't question it.
Yeah.
And the doctors are not used to patients questioning.
Listening. Yeah.
And that's the same in the ER. I ended up in the emergency a couple of times, and there were nurses who were not explaining to me what was happening. They were grabbing my arms, and I said, wait, stop. What are you doing? And she was dumbing the information to me. So
Yeah.
that was me belittling. As far as unpreparedness, sometimes if you go to the specialist and you can't even think of the answers to ask because everything is just overwhelming. So you think of them the moment you set your foot home.
Yeah, exactly.
Now how do I get in touch with him? So yeah, that's the thing like that.
Yeah.
And two questions is the sense that, maybe I shouldn't ask this because maybe the doctor thinks it's a stupid question when in fact nothing is stupid, but that's the feeling that we have, right?
Yeah.
Sorry for extending the explanation.
No, surely, Sheila, that's absolutely brilliant. What you've offered in there is exactly what we want to hear in terms of, because it brings to life just the reality of it. It's the idea that there may be a culture of the health professional isn't expecting to be questioned, right? Or that things are at such a fast pace that it's only after the consultation that you realize what you wanted to ask, right? Or that it's the idea that my question might be considered as too silly or too minor, whereas in actual fact, nothing is ever minor. So it's having that confidence to know that even if they're not expecting a question, you need that question to be able to understand, and it's being able to feel a kind of that you're not alone in that, because sometimes even the knowledge that you have the right to ask the question, regardless of which country it is, regardless of which culture, you have the right to do it, is enough for some people, right? But thank you so much, Sheila. Zoe, did you want to add anything in at this point?
Yeah, I mean, for me, I always think like when I go for a consultation, like you're given a lot of information, like they'll be looking at your blood results and then they're talking to you. So then you start to this is me personally, then I start to concentrate on the information that they're sharing with me. And then the things I wanted to ask then, I forget. So I'll come away thinking, I forgot to mention that, or I forgot to tell him I was getting headaches because I was so fixated on the new information. So, and I know I really need to like write a list down and take it with me. But at the time, I'm just like, yeah, it's okay. I know what I'm going to say. I know what my new side effects are, symptoms are. Therefore, I'll just share that. But then I forget.
Yeah, and what I would be recommending all the time is asking to record the session, right? But what stops us doing that? Because people don't. I mean, I have clinical appointments, and I'm quite happy for people to record the session because it means that it's a relief to me because I know that they'll be able to go back over it if they need to or they want to. And it also means that I am much more mindful of that it's being recorded, so I am much more careful and measured and hopefully more eloquent in terms of how I describe things. So we'll bring John in, but then I am going to put whether anybody is asked to record a session and what the response has been. But I'll bring John in first. So go on, John.
Yeah, I was going to echo what has just been said there by Zoe. Very good at having the questions to ask, but as you go through the answers to those questions, sometimes it's not being able to assimilate the follow-up questions or what does that mean, in that moment as such. So so I think that's just to be mindful of as well, because you're presented with new information as a result of the questions that you might have asked. And so, then you forget, I should have asked this question and following up on what they'd said. So that's what I wanted to add.
No, this is it. And so may I put it to everybody, has anybody ever asked to record it? Because no. What stops you?
So,
sorry,
go ahead.
Well, actually, like I have a very similar experience to Sheila in that I live in mainland Europe, and it's like also a cultural reason. So basically, because I live in the Czech Republic, I feel like, I mean, questions are already met with a lot of kind of disdain. And then it kind of harks back to communism in this kind of way that people would kind of like record things and snitch on each other. So if I were to ask to record something, it would really like hit a nerve in them because of the cultural history of the place.
Yeah. Thankfully, I would suggest that, and others may have had different experiences in the UK, but I would always be encouraging people to ask, would it be okay if this can be recorded? Just so that I can remember it better, right? So that's in the UK, and that might be met with kind of no, or kind of not received well, right? But you can actually ask for that. But I'm just wondering, I admit I don't work in mainland Europe. And so some of what I'm going to be saying through the rest of the session may not actually be something that you feel comfortable doing. But I suppose the main thing is for you to have that confidence to pause or to have prepared beforehand what questions you want to ask. Because also, I know that within the UK, then there is an option whenever you've got something quite as rare as you guys have got, is the opportunity to get to know your health professionals quite well. So the opportunity to actually ask afterwards through email, and that or ask your community afterwards. So I might be saying things which people say, no, I can't do that. But I want to put it to you, because when you think about it rationally, there is no reason why you can't do those things, right? So anyway, Sheila, I'll take your question now, and then we will have to move on.
Not a question, is a comment. There is no way in this world that in Italy, doctors will allow you to record for a simple issue of liability.
Yeah.
Absolutely no way. And so so I laughed at that. I think my doctors would say, what? No.
Well, so it comes. So again, some of what I'm saying may appear naive in some respects, but it's also putting it out there as it is an option, right? But I suppose it also stresses the importance of taking somebody with you, if possible, that you're not doing it on your own, and that somebody isn't kind of taking the notes in a kind of judgmental or a kind of suspicious way. They are literally taking it so that you can actually adhere to the recommendations in the best way possible, because the research applies to mainland Europe as well. If patients understand what they're meant to be doing, right, then they're more likely to adhere to it, or they're more likely to offer in some of the problems within their own lifestyle, which means that it may be tricky and it needs to be adapted. Okay, I'm just mindful of time, and always when I'm doing these webinars, I'm thinking, well, we could do a whole day on this, if not longer. But what I propose is we're not going to cover all the slides. So I think we'll do the recording as much as we can, and then I will do a voice over to the slides that are outstanding. Okay, so I'll stop sharing this particular one, and we'll go back to what am I talking about? The slides that I created for the webinar. Right, so we've done that. Right, okay. So what people will say in terms of, from the research, basically the common fears, the reasons why people hesitate about speaking up are they feel intimidated, and I think we've picked up elements of that in terms of our word cloud. They feel rushed. Right, so that the intimidated bit where and definitely from what Sheila was saying, that doctors are often perceived as authority figures. The medical environment for some people feels even unfamiliar, even though you may have had this condition for quite some time, and that those kind of perceptions get in the way of you feeling easy in terms of what you can communicate. There's also feeling rushed, that there is a busyness, most certainly within the NHS in the UK. There's a constant busyness, and we know how under pressure these people are. And we are all human. We empathise. We see that they're busy, but it's trying to kind of step back and realise that you are important too. Feel of being judged, which we picked up on, or dismissed, or the difficulty understanding medical jargon, even though in my other lives, I do communication training for doctors and other healthcare professionals. And so we talk over and over and over about the importance of making sure that people understand the terminology. And yet still, like many professions, we default to some of our jargon, but you need to be called out. Me as a psychologist, if you're not understanding what I'm saying, I'm not achieving what I need to achieve. So it's important that people feel comfortable to actually say, Lesley, I don't understand what you've just said, right? Or I don't understand the term that you've just used, okay? And also not knowing what the right questions to ask, okay? But you're not alone in this. And if there's one thing that you can take from this webinar, is that kind of that confidence being buoyed up by the fact that you're not alone, that these are shared. Okay, that certainly within the UK, the health professionals are trying to do their bit to actually help people to see themselves in partnership, but still that this kind of feeling that of anxiety tripping you up is getting in the way of you actually being the communicator that you would be in any other part of your life. Okay, so let's think about it in more detail. So this is me coming in as a psychologist, right? As soon as anybody is anxious, they are going to get caught into this kind of habitual, unhelpful pattern of thinking, right? Overwhelming emotions, tricky body sensations, and maybe feeling completely heart going like the clamours. They've just received news that they were unexpected. They're going forwards in terms of how am I going to tell my children this, going back in terms of what is this going to have, what are the implications for me in terms of my job. Your mind's going all over the place, right? So if there's one thing that I can recommend, if you haven't already done the Managing Stress course, do it, or do it again, but with these particular situations in mind, and ask the facilitator of either moving forwards or managing stress or mindfulness to use a theme of going into a doctor's appointment as one of the key things you want to work on in terms of managing your anxiety in that space. Because whenever we're stressed, right, stress is natural. It's designed to actually, ironically, to help us, right? But it means that we freeze, right? We freeze, we don't know what to say, right? Or we appease, we think, oh, well, I won't ask that because it'll be silly, or we'll just do it their way. We flight, we just like, do you know what? I just want out of here. They're not going to help. There's no point. I may as well just leave. Or we fight, we get angry, and sometimes quite reasonably we're saying, why aren't you listening to me? Or we get angry after the fact, right? Rather than in having that kind of that that anger fueling our wish to actually get clear what's going on for us and clear in our questions. And also, we tend to fuel our anxiety by being critical of ourselves, and well, I shouldn't be like this, or people are going to question me, or they're going to see me as a difficult patient, or they're going to say, oh, you're overly anxious, or you're always catastrophizing, right? These things are all dealt with in our managing stress courses. And so one of the things I'd love to do is actually invite you into that if you haven't already, or we set up another webinar which is all about managing your anxiety in a medical consultation. Because if you can manage your anxiety, then you are in a better place to actually ask the questions that you need to ask. I'm zipping through here now, so I'm not going to talk about these in length, but it's that idea of finding a way of kind of just settling the busyness in your mind so that you can actually be in a clearer space to actually ask the questions, right? And that's way beyond this webinar to actually talk through in a lot of detail. And so I would be inviting you to come and do an individual session with one of the emotional wellbeing team around that, or join one of the courses. Okay. But the other thing along with the kind of the finding ways in which you can manage your own anxiety. And we've talked about the fact that we can empathize, we can see that people perhaps culturally, they're not, the medical staff aren't used to being questioned, or we can have we may be that we have a mutual respect with our medical professions, and we've got a good partnership going on, but we still need to prepare. We still need to, so that we're in the best place possible. So now we're going to talk about preparing for consultations, finding your voice, what to do if you're feeling rushed, and what to do if you're feeling overwhelmed. And we're not necessarily going to cover all of these because I can feel myself going like the clappers already in terms of trying to get it all in. But one of the things which I would be encouraging, and this is me as a psychologist saying it, if there's any way that you can calm some of the stuff going on in your head, right? And that's what I'm meaning. First and foremost, from this webinar, I'll give you lots of top tips, right? But if you can do some individual emotional well-being, anxiety management for consultations, come to it. That is crucial. If we can help you with that, we've done something good. If talking through with Zoe or one of the others in your community to help you feel more confident is something that you can do, that's something that will help in terms of going into an appointment, right? So I just want to stress that in terms of, after this webinar, ask to speak to somebody separately. And that can, or come on one of the courses, right? Because that will help you with that inner voice of, oh my God, they're looking at me as if I'm an awkward patient. I want to leave, or I'll just shut up. No, we will teach you strategies to kind of move your way through that, which are very specific to you. But in terms of what's out there, and there'll be handouts that go with each of these things, is that when you look at the research, if you can go in with an appointment prep sheet, right? So you can go Google appointment prep sheet and you'll find them on the internet. And they just help you to be much more organized when you're walking into the consultation in terms of what you're looking for, right? And obviously the research also says if you can practice those questions beforehand with somebody else, right, then you're more likely to ask those questions in the actual consultation, right? And the other is that if you have a relationship with your medical professional team, which I know a lot of families do, they've known their team right the way through pediatrics, right? If you can send an email beforehand, that's really helpful. Okay, or even in composing that email beforehand helps you to actually be much clearer in your mind about what you want to actually ask. So I know this sounds so basic, but this is when your anxiety is up here and you're being met by a doctor potentially who's wondering why on earth you're asking questions and it's not really culturally appropriate, and you can't have it recorded, then it's those basic things are the things which are needed. Okay. So there's a handout that goes with each of these slides. then the second bit is the kind of, and I am speeding up dramatically at this point, right, is the finding your voice. And what the research says out there is that finding your voice is not being aggressive, right? It's just being clear and respectful in terms of advocating for what you need, right? And the research says if you can advocate for what you need, there are better health outcomes. So your doctor's going to have better success in terms of treating you, right? And so one of the things that is often kind of put is this idea of using I statements, okay? So I want to explore other possibilities, right? I know that I'm talking to Sheila and Minnie in mainland Europe, and it may be that they look aghast at you for the very suggestion, but please bear with me there in terms of I've got to say this on the webinar, right? You have every right to say, can we explore what else might be possibility here? Or I'm concerned about the side effects I'm experiencing, or I feel anxious about this experience, or I'd like to understand the treatment options more clearly. You have every right to ask those things. It's just that everything in the room, the busyness, the kind of the culture, the kind of the knowing that you've only got 10 minutes or whatever, really kind of mean that you hold back. But you're not being awkward. You're actually trying to place yourself in the best position to take on the treatment that they are recommending and for that treatment to work, okay? The other suggestion in terms of finding your voice is doing what's called a teach back, right? And I don't know whether I'd feel comfortable doing it, but I do invite this of my patients is to say, if I'm not making sense, please ask me. And one of the things which I'll ask them to, what I mean by that is this thing called teach back method, whereby you would say something like, so if I understand correctly, what you're saying is, right? Now, I will not see that as patronizing, right? Some people might, right? But again, the intention is for you to understand. So all you're doing is asking for clarity, right? You're asking just to confirm that what you're hearing is actually what they're saying. Could you draw a picture for me on this? It's perfectly reasonable. And I know that Sheila's like laughing. I can see you laughing, but I've got to put this forward. Could you write that down for me? Sheila, do you want to come in?
I laughed because I'm an endocrine patient. I have a rare disease called acromegaly. And when I went in for what then turned out to be an MRI that confirmed I had a pituitary adenoma, I came out and the technicians had a very worried look on their head. And I said, okay, what is it? Oh, no, you have to wait till you get the report. And I said, no, I'm not going out of here until you tell me what it is. Mm-hmm. And they said, you have a pituitary adenoma. And I looked at them and I said, okay, draw me a picture. I said, I know it's in my head because that's what you bombarded with sound and everything. But I said, draw me a picture. And they looked at each other and they said, a picture? And I said, yes, paper, pen, draw. And so, yeah, that's why I laughed, because it reminded me.
Because if I can tell you about my other life in terms of teaching medical professionals around communication, it would be don't make any assumption of anybody understanding what you're saying. Draw a picture, right? Draw a picture and point out where it is, right? And so you asking for a picture is not strange, right? And even in mainland Europe, they get the same sort of medical communication training. So please, so I can't stop at this point to ask anybody if they've been successful in that. But what I will say, and often in pediatrics are much easier, they're much more willing to actually be more creative in their communication. So I'm just putting out there what the research says, okay? The other thing that it says is that body language speaks volumes, right? So it's the idea of not being sitting upright, isn't maintaining combat, having an open posture is not you being aggressive. It's you actually trying to make sure that people are actually listening to you, right? And I do know that from body physiology, if you sit upright, you give your body much more freedom to breathe, right? Which helps. It means you're not hyperventilating and adding to the anxiety. It also means that in terms of your endocrinology, and this is from Amy Cuddy over in the States, a professor at Harvard, is that you're actually helping your body hormonally. If you're sitting up, you're helping your body to feel more empowered hormonally, right? So these little strategies in terms of body, it's not just body language, but how you sit, your posture actually helps you feel more confident, okay? So the next thing I wanted to do is the decoding of the medical language is you have every right to say, I'm not familiar with that term, what does it mean? Okay. And even if you have it on a sheet of paper at the top of it in front of you, you can say, I am not familiar with that term. What does it mean? Right. And you can say things like, can you break that down for me? Because again, in medical communication training, they are taught to chunk and check. They're taught to give a chunk of information and check their patient's understanding of that. Right? Not just their understanding, but also emotionally the impact of it. Right? So asking to have it broken down is cueing them to do what they've been taught in medical school. Right? And so I am skipping through them now, but there are handouts. Okay, the feeling rushed, right? So the main thing about the feeling rushed is that things are busy. Everybody is busy, but in order for you to be able to understand and actually do what's being asked of you of that treatment, you have to kind of slow things down, right? And you have to, where possible, be open in that this is very rushed. I feel that, sorry, just a second. I feel that I'm not taking this in, and I may need to actually have a follow-up appointment. Right. And I don't know how people might feel about that, right? That maybe they may feel uncomfortable about that. But how about if you, towards the end of the appointment, saying, could you just summarize the key points to me? There was a lot going on there with a lot of information. Could you just summarize those key points? Or could you send me a letter or the letter that you send out so that I can see those key points summarized? And it may be, yeah, maybe that the letter, I know that within the UK, that the clinician, they're taught to write the letter as if the patient is going to read it, or so hopefully it wouldn't be too stark, but sometimes that's one of the best ways to actually get that summary. Okay, I'm just again I'm mindful of time, so I am having to speed up a bit here, but that feeling of overwhelm, it's basically don't go in on your own. If you can take somebody else, I know it sounds so simplistic, but if you can take somebody else in with you who can be listening as well, that's one of the key things, which is, if nothing else from this webinar, it's that one. And also follow up with questions. So if you can communicate with your doctor or your clinical nurse specialist or wherever else is in that team afterwards, or seek advice from the community, if you or Better Together or whoever you do trust in your surrounding. If you come away from a hospital appointment feeling you really don't understand what's going on, then reach out. Don't feel alone with this one. Okay. And the other is the idea of working together, so building that trust and rapport. And this is where it's a whole different webinar that I don't think we're going to be able to cover this properly. But it's that idea of this is not a battle, right? It may feel like it, but it's how can you speak with others around you so that you're going in there, even if you've feel dismissed in the past, even if you feel that some of your questions have been dismissed in the past, how can you go in with a lens of, I want to be the person that matters to me. I am a compassionate person. This is you talking, you patients. I'm compassionate, I'm understanding in all sorts of other elements of my life. I'm kind, I'm measured, right? I want to go into this relationship in the same way, right? So how can you remind yourself of yourself as a person? So go on, Sheila.
I just wanted to suggest that perhaps it would be useful also to involve the healthcare professional and perhaps create some scenarios in front of a group of patients or other peers so that they understand the challenges of maybe simplifying a complex medical concept, and also to understand what the patient goes through.
Yeah.
Because this is the holistic part that the clinic
Exactly.
doctors don't look at, because they're concerned about the clinical aspect. They don't think about the holistic, like the impact, the burden of they want to see the patient get better. The
Yeah.
patient wants to, hey, I don't feel good after this medicine. What can I do besides taking, I don't know, something or resting?
Yeah, exactly. And it's if they look at if they look at something holistically, the person is more likely to feel better or more likely to be more well managed. So that mutual, and one of the things that I know is happening within various of your communities is that you have family days or conferences where you invite the health professionals to be part of those conferences. And the more that we can get your stories to them, right, then the more that they are going to be seeing a person as a person and very similar to them. They've got children, they've got work life, they've got responsibilities. They're not somebody who is just at home being a patient. They are trying to take on, particularly if it's a chronic condition, take on a treatment regimen which has to fit in to life, right? And they want to have a discussion with you about how they can reach that. Yeah. So any way that you can bring them in to your life or help them to understand patient stories, then yes, absolutely keep doing it. So those are the conferences, and inviting them to come and talk about what they want the families to hear, but also the families are given the opportunity to tell the clinicians what they want them to hear, right? And to not feel to really use the communities, use the charities that you're part of, using whatever kind of patient-led organizations that you're a part of to actually get that across. Okay. And I think, Sheila, on that note, I think we're going to have to finish now. But these I kind of drew together the top 10 things that to feel more confident. There's the preparation, to assertive, the teach back, to trusted companion, to focus on your body language. Don't be afraid to ask a question, but also choose a doctor you can trust. But one of the things is to remember the rights of your patient. And in that, I'll add an extra one, is that make sure wherever possible, invite your clinicians to be part of any gathering when they're hearing stories about you as a person, not just as a patient.